Hi, today I'm going to demonstrate a Foley catheter insertion on a female patient. First, I am going to wash my hand, perform hand hygiene, and then I will provide patient privacy by closing the curtain or the door. And I will be in the patient's room. I will explain the procedure to the patient and ask for permission. Hi, Miss Bear, how are you today? I'm your nurse, and the doctor has ordered a Foley catheter insertion for you today. Is it okay if I perform the Foley catheter insertion for you today? So she said okay, and then and I'm gonna go ahead and ask her if she's allergic to shellfish or latex gloves. Miss Bear, are you allergic to latex gloves or shellfish? Because those are the part of the material that we'll be using today for your Foley insertion. And she said no. Okay, so I'm gonna go ahead and get started. I already have a Foley catheter kit. Assuming that this is the kit and it's sterile. What I have here, I will have established sterile field. I am gonna be careful about not hovering over my sterile field, and I will open my sterile supplies within inside the sterile field and not within 1 inch of the border. So first I'm going to put on the sterile glove by grabbing the inside of the glove, sterile glove. And okay, and I'm going to grab the other one. Now I'm going to adjust my sterile glove. And I like to test the Foley balloon, make sure that it's patent. So let me go ahead and do that. I have a 16 French Foley catheter here. And I have some saline. Insert 5 ml. Well, I'm assuming this one has a balloon, but it doesn't, so assume that if there is a balloon, the balloon will inflate around here, and then I will see a 5 ml of saline coming out in the balloon, and then I'll let it actually retract it back to my syringe. So it works. Let's assume that. And now I'm gonna go ahead and open the lubricant right here, and I'm gonna open the betadine swab, 3 of them. Now I'm going to go ahead and make sure also that I'm going to drape the patient. I have 2 here. One's going to go around the Foley insertion site, one is going to go underneath. And assuming that this Foley is already connected to a Foley leg bag or the bag that goes hang to the bed. So I'm going to change my camera now, and I'm going to go ahead and proceed with the insertion. So let me move the camera. So assuming this is the Miss Bear, So I'm gonna go ahead and drape the patient with tucking one underneath without touching her as much as possible, and then tuck another one, draping over a private area. And with one hand, my non-dominant hand, I'm gonna go ahead and open her labia, and right underneath, I should looking for the urinary opening, and then which is above the vaginal opening. So it's the first opening. And with my betadine swab, I'm gonna swab the outside area first. I'm gonna dispose it. Another swab, betadine swab, is gonna be inside, and I'm gonna dispose that. The last swab is gonna be in the fold of the labia, as close as possible to the opening. Now, I'm gonna bring my tray here. I'm gonna go ahead and lubricate my Foley catheter, and with my contaminated hand still opening the labia, I'm gonna continuously insert the Foley catheter with my sterile hand and keep inserting until the urine come out. When I see steady urine stream coming out, I will keep it there and go ahead and use my insert the 5 ml of saline inside the balloon and lock it and extract it. So now, assuming the balloon is already inside the bladder, now I can just gently pull it a little bit, and so if there's resistance, it doesn't come out, so it's already locked. The balloon is already inserted. So with this catheter inserted, connected to the Foley bag, I'm gonna go ahead and drape it across the patient's leg and hook that to the bottom of the bed where it's not movable part, so you stay secure, and also secure the enough space here for the patient's leg, so when the patient's move, it doesn't yank her Foley catheter. Now I'm gonna go ahead and dispose my supplies. And ask the patient if she's okay, and she's okay, and I'm gonna go ahead and dispose my gloves and wash my hand and document the procedure and finding. And that's my end of the procedure. Thank you.